Just looking at the time, we are going to need to keep moving. So thanks very much. I'm not sure if you're able to continue to join us online. If so, that's wonderful. But for now, we'd like to move on to welcome Dr. Affan Shoukat to speak on using AI to predict disease outbreaks. So Dr. Affan Shoukat is the SGI Assistant Professor of Data Science in the Department of Mathematics and an adjunct professor in computer science at the University of Regina. His research focuses on understanding infectious disease dynamics, assessing the risk of emerging epidemics, forecasting temporal and spatial trends, and evaluating the economic impact of health interventions. His work integrates real-world data with computational models, including machine learning methods to generate actionable insights that strengthen public health programs and policies and support public health decision-making. So please join me in welcoming him up to the front. Thanks.
Okay, thank you for the introduction. I don't know where to put my coffee. Should be okay. Thank you for the introduction. My name is Affan. I'm an assistant professor here at the University of Regina in the Department of Math. And my research involves modeling infectious diseases and looking at how infectious diseases spread through a population through mathematical models. And these days I'm more using machine learning and artificial intelligence tools rather than our traditional models, which I will touch upon a little bit. In my talk, it's a short talk. This is work that I've been doing with my graduate students, with my PhD students. And it's essentially, the bottom line here is that we are trying to build systems, machine learning systems or artificial intelligence systems that lets us predict outbreaks before they happen. So let's get started. The world is a more connected place now. We have lots of connected travel. We have globalization. Everyone is meeting each other. In addition, we have a loss of biodiversity. We have rapid urbanization. What all of these things are causing are increased spillover events. They're causing an increase in the frequency of outbreaks that happen. So just up there, I have a figure of all the outbreaks, not all pandemics, but all the outbreaks that have just happened in the last 20 years or so, right? And we all remember COVID. That was 2020. That was only 5 years ago. It feels like an eternity ago. It was only 6 years ago. And since 2020, since COVID, we've had polio outbreaks, we've had mpox outbreaks, we've had dengue outbreaks, we've had measles. In Canada, it's a big issue right now. And so we are getting outbreaks that historically used to happen every 100, every 200 years. And now we're getting them every 5 years. And so this is a cause for concern. And, people die, and there's a significant harm in our societies and our communities that if we can get ahead of an outbreak, then perhaps we can avoid a lot of unnecessary suffering and burden. So, hold on. There we go. Just to remind people of other outbreaks, in 2001 we had the SARS outbreak. Who remembers that? Right, that was a big issue. Then there was the Ebola outbreaks, remember? And then the Zika outbreaks that started in Brazil and sort of spread around that region. These never ended up being big pandemics like COVID was, but nonetheless, one had pandemic potential, and based on some loose definitions, we could call them pandemics because they had a global effect. So how do we currently deal with outbreaks? How do we deal with diseases? We have surveillance systems, and everyone knows about surveillance systems. The ones that we traditionally have are called sentinel surveillance systems. And these are surveillance systems where we rely on clinical data, right? We rely on people who are sick, but not only are they sick, they have to be sick enough to feel like they need to go to the doctor or a hospital. It has to be a notifiable disease. And if those things line up, then only do we get that this particular person is sick and infected with a pathogen in an official database. But that usually doesn't happen for a lot of cases. If you have flu or if you have even COVID, what do? You're just at home. You isolate yourself, maybe you have some soup, you watch some TV, and you just wait it out, right? Public health never knows that you're sick. And with COVID, I'll use COVID as an example. This is actually what caused the pandemic. This was one of the root causes, which was that COVID has a pre-symptomatic phase. There's about a day or 2 days, 24 hours to 48 hours, before you start showing symptoms in which you're infectious. You are able to transmit disease before you show symptoms. And asymptomatic and pre-symptomatic individuals, people who didn't show symptoms but were infectious, were largely a big reason why COVID got out of control. And it's because we don't know who they were, unless they go to the hospital. And why would you go to a hospital if you're not showing symptoms? It's impossible to capture these people in a population. So our traditional surveillance systems are sentinel. We rely on notifiable systems where if you're sick, you go into the hospital, they will then notify the government, who then maintains a database, and that's how I get my data to run models on. But of course, this is a lagged system, right? If you're sick, it's probably 2 or 3 days after you've shown your symptoms, or maybe a week after you've shown your symptoms, where you actually end up going through the process and going to the hospital or the clinic. On the other hand, we have newer technology now. Everyone's got a phone in their pocket. We can look at other data. We have something called syndromic surveillance now, and this is looking at indirect measures of individuals that might be sick. So if you are sick, or if there's a big outbreak in a population, let's say any respiratory disease, you may want to look at pharmacy sales, because an increase in Tylenol flu, or Tylenol cold, or whatever they call it now, an increase in that could potentially mean that there is an increase of pathogen inside your population. You could also look at search query trends, and this has been done before. Search queries and Google search trends have been used in the past to actually predict outbreaks before they happen. And it's because when you're feeling sick, you tend to go online and say, what are the symptoms of flu? How do I make chicken noodle soup? What shows can I binge watch when I'm sick? And things like that. And those can be indirect measures for, again, a pathogen that's circulating in the community. I've highlighted a few other types of syndromic surveillance, which is social media trends. This is a big one, which doesn't really work anymore because the biggest platform, which was Twitter or X, or again, I don't know what they call it these days, they've sort of shut off that tap. We are not, it's a little bit harder to get social media trends. Same thing with search query. Google had this thing called Google Trends, which still, I'm not sure if it's still active or not, but it definitely is not being used as much anymore. Media articles is great. Now I have an example for media articles. So that's the next slide. And then the last one is wastewater, which is what I've been using for the last couple of months to see if we can use wastewater to see if there's pathogens in our community. So syndromic surveillance is the type of surveillance that will allow us or potentially allow us to detect an emerging threat and deal with it before it becomes another COVID. The problem with syndromic surveillance is that it's not the data. It's the sheer volume of it and the fact that it's unstructured data. Right? It is not clean data where you have a time series of who's infected, at what time they were infected, or what day they were infected, and what their severity level was, and so on. It is just very messy, incomplete, inconsistent data. And the one thing that a tool that we have to deal with this is artificial intelligence. And maybe you've already heard the definition of artificial intelligence a few times, but very broadly speaking, it is a set of tools, a set of algorithms, a set of models that are able to, that refer to computer programs to perform tasks that usually require human intelligence. At least that's my definition of it. That's how I think of artificial intelligence. And so using AI, we can build tools, we can build AI systems that can continuously go through this data and detect patterns, detect anomalies, detect trends in this. We can teach the system to detect these anomalies and figure out these trends in the syndromic data. Which then allows us to build more accurate early warning systems, allows us to have more efficient public health response. It allows us to, allocate resources more efficiently. And that just translates into protecting our communities in a much better way than the traditional ways. So this isn't just academic research. This has now been, there are platforms that already have built these systems. For example, Blue Dot is a company that I worked for a couple of years ago. They are a startup that is based in Toronto. It's a Canadian company. And they use machine learning to scan news and media articles, even official reports, for early signs of outbreak, right? We have the World Health Organization, EOS, which is again is a platform that uses automated text mining to see if there's something of interest in online data to detect emerging threats. EcoHealth Alliance is another platform that has a similar function. So yeah, I used to work at Blue Dot, and it's an interesting story because, like I said, syndromic surveillance is messy. It's hard to deal with. And so I was building these systems when I was there. And I remember this one time we got an alert. And it was basically, there's a large gathering in which anthrax has been detected. And that raised a lot of flags and alarms because, if it's something like that, that's an attack and needs to be notified. The government needs to be notified right away. We kind of dug into it. It turned out it wasn't an anthrax, a disease. It was a banned anthrax that just held a concert with 10,000 people. And our system sort of picked that up as an anthrax being circulated in a big crowd. For some of you, you may not know what anthrax is. The band Anthrax are a band from the 80s, and so maybe that example doesn't land with everyone. I didn't grow up with Anthrax either. I'm a little too young for Anthrax too. I didn't know. That's why I got confused. I saw this alert come up, and so going specifically to wastewater as a data source. It is one of the most concrete, most unbiased data sources that we have. It is essentially the most honest data source, and that's because it captures everyone, regardless of your severity of disease, regardless of whether you're asymptomatic or pre-symptomatic, regardless of whether you want to go to the doctor or not, you will go to the bathroom. Everyone goes to the bathroom, right? And so whatever's inside you will come out. And Canada, I don't have the figure here, but Canada actually has a surveillance network throughout the country. I think we have 76 sites across the country in which, and Regina, our wastewater treatment plant in Regina also does this. They collect samples from wastewater and then send it over to a lab. The lab then isolates the pathogens, sequences the pathogens, and puts it up in a database and tells us, on average, how much pathogen there is in that wastewater sample, which you can extrapolate. You know, the Regina wastewater treatment plant captures roughly all of Regina, and I think maybe a few neighboring towns and cities. And so you can, you know, based on that, you can figure out the average level of pathogen circulating in the community. And yes, we don't know who is sick, but that's not the point, right? The point is we know that we can detect pathogens, and if we can detect this early enough, then we can call public health and say, you know what, Regina is experiencing an increase of COVID or flu, and it's better that you guys come here and start your response, maybe have some vaccine campaigns, make sure there's masks and other NPI interventions available for the hospitals, for clinics, and just allocate our resources efficiently. And again, this isn't going to prevent an outbreak, but it does give us an early warning. It does give us an early start, and perhaps it does prevent a large outbreak. Maybe it prevents one additional death, which is more than enough to justify a system like this. The benefit here of wastewater is that you don't have to show symptoms, and I think that's really the highlight of the system. We are able to capture. If you plot wastewater trends against clinical cases, the wastewater trend is always shows an increase in cases before the actual cases come up. And that lead time is about a week. And that might, you know, for depending on the response, that may be enough, that may not be enough time to, for example, roll out vaccine campaigns, but that may be enough time to make sure hospitals are ready and clinics are ready and they're all staffed up and, you know, stocked up with whatever supplies they need. So this is what I was just talking about. We are building systems. I'm particularly building, you know, our research in my lab. We are particularly building a system in which we are developing an early warning system. And here we're just looking at, we're training an AI model to continuously monitor wastewater data throughout Canada, and from there detect whether there is an anomaly. And that's really the bottom line. I mean, we're not doing anything more than that, and of course we're going to have false positives, and that's okay. But we are trying to build a system, just like those platforms that sort of already exist, just a little bit more advanced versions of those, to be able to detect outbreaks in Canada so that we can stop them. One thing that I'm pushing for is wastewater wastewater collection, wastewater epidemiology in airports, because one of the main sources of a new pathogen coming into our country is through the airport, and that's exactly how COVID came in. And so if we can build surveillance right in the airport, and continuously monitor that surveillance, that data, perhaps we can just stop it at the source. This is just what I'm talking about now, is just an advanced version of what public health calls contact tracing. Contact tracing is very intensive in terms of resources required, but when you have wastewater, you know, there's two ways to do this. You can have wastewater at the airport level, so it's sort of looking at everyone, and then you have wastewater from the particular airplanes that land. And that is probably the strongest source of potential introduction of a pathogen that could happen. Anyway, so this entire field is considered is called precision public health, and it's sort of moving from a reactive system to a proactive system. It's moving from a traditional sentinel surveillance system into using more syndromic surveillance. And it's just the ultimate objective here is to make sure We have optimized resources, right? We want to make sure masks, vaccines, alerts are sent where they're needed and when they're needed. And yeah, just global resilience. We need to build robust early warning systems, not just in Canada, but globally. For countries like the U.S. and Canada and the U.K., this is not that tall of an order, but for low and middle income countries, this is something that they could benefit from if we can warn them that something is about to happen. Thank you. Happy to take questions.